Today on Aging Wisely, we're talking about all the things you can do to prevent falling and getting hurt. Hello, I'm Dennis Bounds, and welcome to Aging Wisely. Today's program is about fall prevention for seniors. We'll learn about the common causes of falls and the type of injuries that can happen. We will also hear from emergency workers and home safety experts about things you can do to prevent an accident in your home. Plus, see a few exercise programs that can be done individually or with a group to become strong and stable so you can stay safe and prevent a fall. Let's start off with the common causes of falls, things like trip hazards, balance issues, and even medication side effects. Here's what you need to know about how to decrease your risk of falling.
Falls in older adults are not normal. We know that falls have known risk factors, and what you can do to help yourself prevent falls is talk with your primary care provider and identify what your unique risk factors are. Then you can work with your provider to reduce those risk factors. And you can work with an occupational therapist to help them identify home modifications that could be made to make you safer in your home.
In the state of Washington, about 27% of elderly people will experience at least one fall, and about 20% of those will result in death. So avoiding falls is a good way to live longer and not have severe injuries.
There was an article that was created by the American Geriatric Society, the British Geriatric Society, and the American Academy for Orthopedic Physicians called the Guideline for Prevention of Falls in Older Adults. And this article identified the most common risk factors for falling. So the number one risk factor for falling is muscle weakness. The second most common risk factor is a history of falls. Number 3 and 4 are gait and balance deficits, and number 11 is an age greater than 80 years. So it's very interesting because age all by itself is not a good predictor of falling. But the top 4 among them are muscle weakness, gait and balance deficits. Those are all modifiable risk factors. You can work on those risk factors and improve them and reduce your risk for falling.
One of the common culprits are medications that are used to treat anxiety, depression, and high blood pressure because what they can do is make us dizzy and disorient us, and we lose balance, which is crucial. If you're trying to not fall, you need to have good balance. And so these medications will treat those primary conditions, but the side effects can definitely be the reason why we fall. It's important to tell our doctor because they might be able to help us avoid a fall in the future. And one interesting statistic is that once somebody falls the first time, they have a much higher chance of falling in the future versus someone who has never fallen. So if we discuss this with our doctors, they can do things like reviewing our medication. Maybe our high blood pressure pill is too strong. Maybe they can drop it down a notch. They can also assist us in referral to programs that will strengthen us. They can give us advice. They can ask questions about our home situation and whether or not it could lead to a fall. So having a health professional be aware of a problem early on is good. And there should be no shame or embarrassment in it. It's something that happens to a lot of people.
A lot of seniors want to stay in their homes as long as they can, which is why taking a little bit of time now to make your home safer can help you stay in place for years to come. Let's follow a contractor as he visits a home and recommends easy fixes to improve safety.
Hi,
Good
Bob.
morning.
I'm Mark with Rebuilding
Mark.
Together South Sound.
Bob Reither, good to meet you.
Nice to meet
Yeah,
you.
it's good to have you
Just
here.
noticing here, you got a beautiful sidewalk coming up here, a nice ramp made out of it.
Yeah, this is the first thing that we did when we moved into the house. We used to have 3 steps that came up here and a very small little porch, and so we replaced it with a ramp and a little larger area here.
This is good. You just want to keep maintaining it. It was down on a good sand base, and that these don't move over the years.
You bet.
So you just want to keep an eye out for that. The other thing I noticed, you don't have a screen door, which is also good. That way you
Okay.
don't have to get through two doors when you're trying to get in.
Ah, okay.
So
don't put that.
disadvantage though is having all these rugs here. It's
Okay.
going to be a tripping hazard. Someone can very easily trip over these because there's
Yeah.
several different heights of things here.
Okay.
So I did notice your door handle could be a little bit difficult for someone to, if they have mobility issues in their hands,
Sure.
it might be hard for them to do the thumb on there.
Ah, okay.
So a lever handle,
handle
would
instead
be
of
much
this.
more desirable
Okay.
for something
Good.
on that.
Good. And this threshold here.
Yep, the threshold, the outside's really good. The inside is just a fraction high for what they would consider wheelchair access. You really don't want more than a 1/4 inch high. But with the way your house is built and the rugs in there, you really couldn't do much more with this one.
All right. All right. Well, that's all very helpful. Hey, let's go take a look at the hall
All right.
bathroom. Now, Mark, I invited you over here to kind of give us an idea of how we can best work with this house to make it possible to age in place.
Okay.
So what are the things that we could be doing over the years ahead to kind of work on that? So here's the hall bathroom that I wanted you to look at. And I know it's a little small, but it's probably typical of what you see most of the time.
Yep, this would be hard to get a wheelchair in just for
Right.
the width of this bathroom. Typically you need a 5-foot turning circle for that. It is good. You do have a comfort height toilet,
Right.
or a chair height as some people would call it. Your grab bars in there are very good.
We have
So-
all the grab bars.
Yep,
Yeah.
that's good for getting in and out. You have a seat in there for sitting on, so someone's not going to get tired and fall down. You do have a shower wand that someone can bring down and shower with. A small tripping hazard with the rugs.
Yeah, okay. The rugs are
So,
an issue. And,
yep.
and obviously, you know, we've debated about whether to have this tub modified at all. Could that be something that you'd want us to
There's a couple
at?
options. You could make a zero clearance shower to go in there.
What's a zero?
Zero clearance means that your floor height and the shower height are exactly the same.
Oh, okay.
So you could roll in with a wheelchair, or if your legs can't be picked up, you can just walk right in. They also make a step unit you could cut out the tub and put in there to just lift your legs up slightly to get in.
Okay, just maybe a lip of a couple inches perhaps,
Yes.
or something like that. Yeah, okay.
Yes, your handles on here are very good. The handles are easier for someone to grab than a
Sure.
single knob at the top.
They work pretty well. I think it takes a while for the water to get hot, but
Yeah,
eventually
as they
it
will
does.
for.
But what about, you mentioned the wheelchair. There's not a whole lot of room here to move
There's
around.
not a lot of room. You're very
about the door?
short on the door here is only 28 inches wide.
28-inch door.
Typically for a walker or a wheelchair, you're going to want about 32 inches or more.
Ooh, okay.
So you have very little room. You could widen this door up slightly. They make hinges where the door will swing all the way out of the way. You
Okay.
could change the hinges. That would give you about another 1.5 inches
Okay.
of room.
All right.
So your clearance on the floor here is great. It's all hardscape floor,
Okay.
easy to walk
Tile.
across, all the same height.
Okay, well, Mark, here's the master bathroom. It has a couple of issues that I know you're going to find.
Well, I noticed right off your shower door here, with this opening and swinging inside, if someone were to fall, they would never be able to get anybody in there to get them out.
That's right, okay.
So I wouldn't do that. Grab bar is good. You shouldn't put a washcloth on there though.
Okay.
So this one here, if someone were to get out of the shower and grab this, they're going to fall right down on the ground. I would put a grab bar, towel bar combination unit here. That way you could use it for both.
Okay,
be
before I
secure.
let you go, what about what's the alternative to this door?
I would put a shower curtain in.
Shower curtain.
Yes.
Okay, easy enough to do that.
Yep.
All right. In the
In your
area?
toilet area here, water closet is nice, but with a pocket door there,
Pocket door?
it limits your access for wheelchair or a walker.
Sure.
I would take that back to the cabinet, take this door
cut
out,
this
open a
out.
wall. You could put a cupboard. Comfort height toilet and grab bars are good also in there.
Okay.
The height of your counter right now is good for you right now, but later on, if you ever were in a wheelchair or somebody, it would be difficult for them to use it at that height.
Okay, good points. All right, well, let's go take a look at the kitchen now. Okay, Mark, here's the kitchen, and it's got...
Oh, I noticed right off your refrigerator and the counter are too close together here.
Really?
Yeah, you only have 27 inches, and if you open
If
the
I open
door,
this
you're going to
door-
be down to 15 inches.
Okay.
I'm not that skinny.
Yeah, well, neither am I.
So you're not going to be able to have very good access for a wheelchair. This is a little bit high. If you were in a wheelchair, you wouldn't be able to reach up to it.
Okay.
At the same point, your dishwasher's a little low for wheelchair access. The oven's good down here.
Okay.
So
that'll work okay.
Your knobs at the front of the stove is good. It's easy access for someone. I do notice that you have knobs here. There again, that's a little difficult to use if you have hand problems.
Well, the knobs work fine for us.
They're good, but your handles are much better. It's easier for someone that has arthritis or something to be able to stick their hand through there and grab those.
Yeah, okay.
Your access to this sink is going to be a little bit tough with the cupboards there. They do make where you can raise and lower them. They make open underneath. All sorts of options on that you can do.
Okay. Well, and of course, I got my little puppy here. This is Oliver.
Oh, yeah, they're great companions to have. Only problem you do have to be careful of is they can be a tripping hazard for you, whether they're a dog or a cat.
Unconditional love, but not all that safe
Unconditional love, but not that safe sometimes.
Okay. Well, Mark, thank you very much. Appreciate
Absolutely.
your time.
Nice to see you, Bob.
Bye.
Fire and rescue crews spend the majority of their time responding to 911 calls from seniors who have fallen. Sometimes they have to go to the same home multiple times. That's a sure sign that something needs to change. We talked with local firefighters to get their best advice after responding to thousands of falls.
I may have to make some adjustments in my home instead of just keeping things just the way they are. You might be able to identify and prevent some problems down the line. And some of that is maybe decluttering, getting rid of some things that just, maybe they've been sitting there for 20 years in that room, but you don't use them. Is it a potential problem that you could, trip and fall over something like that? And as you age, you have to look at that and go, this rug or this, piece of furniture here is great, but it really doesn't serve me anymore. And now it's a hazard to me. And recognizing that, and maybe just involving your family members as well too, to try and say, hey, I need to, start preparing. Maybe I need to make some changes around the house. Maybe I need to put some rails up in the shower now, to hold on to and balance myself, or things to hold on to that would give me a chance to not fall down and not have these accidents. So not waiting for the accidents to happen first.
On any given day, we'll go on multiple falls for elderly or retired patients in our community. A lot of times we see slip hazards, things like that. People in their shower, people getting out of their shower, they don't have rugs or non-slip surfaces, no slip there. See a lot of people fall due to clutter in their homes, just boxes and clothes. Sometimes people just have a lack of equipment like walkers or canes that they're not using that they should be using to help get them around their home. We'll see lack of rails and things like that. So those are really common reasons people fall. We'll see patients sometimes multiple times over the course of a month or things like that, and it might be new for them and it's new for us to see them. So we have those conversations with them initially about trying to be diligent about using their walkers and their canes and be up to date on their medications, visiting with their physician regularly, trying to clear hazards. When we start to see a patient a number of times and it's a reoccurring process, that's when we get our prevention involved, and we have a referral process for them. And that's when a prevention department can come in and they can assess their home and try to help them build rails and ramps and things like that, or help them assess what their risk is with walkways being cleared, and giving them resources to be in contact with for further help. People have pendant buttons, things like that as well, that they can contact, and if they do fall, they have a resource, so they're not waiting for someone to come check on them. They have a resource that's on their person that they can press and get a hold of 911 so we can respond quickly.
There are so many different reasons why people are falling. Certainly one of those areas happens to do with balance, flexibility, and strength. During our visits in which we provide education to those who have fallen, one of the points that I try to push forward is the use it or lose it, the keep moving. So often we forget how important it is to maintain muscle strength, particularly in our core, in our legs. Our balance is certainly changing as we get older, and there are really great programs within most communities in which you can take advantage of in order to really maintain a healthy lifestyle and keeping your balance.
It's important that people realize that what may be visible to them may not be visible to us. So for instance, just because you have an address marker on your road sign on your driveway and you think that it's marked, well, maybe you have it marked facing from one direction, from a direction at the road from that side, but maybe the fire apparatus and the ambulance are coming from the other direction. We wouldn't see that. Also the access to it. So, you know, is there stairways, is there driveway problems that are going to create problems for us to try and get people and equipment to you as well too.
Really common thing that we see a lot is you get these elderly patients, and a lot of times they're juggling multiple meds, and they've got a system they've been following, but they might not be visiting their doctors regularly and getting those up to date. They might be starting to have issues with just tracking what medications they have or haven't taken, and especially like blood pressure medications, things like that. People take too many, they might, you know, get dizzy, their blood pressure drops, and you'll see falls result from that. So that's a really common thing that we do go on, and it's just really important to get in and speak with your physician and have regular follow-ups and appointments, and have a solid system for tracking what medications you're taking and how many of them you need to be taking on a daily basis.
The value in staying active, being mobile, is really one of the most important things one can do to help keep themselves in a lifestyle where they're active, they can stay at home independently, and they can be healthy.
The main reason for preventing falls is to prevent the injuries they cause and how those injuries can affect your independence. It's important to be aware of the most common injuries that medical experts see, along with their tips for having hard conversations with family members.
Advice I would give people is accept the fact that you're getting old. Everybody gets old, and we just need to cope with it. Have a younger person come over and check things out. You mentioned rugs, furniture. These can be deadly. A little throw rug can slip, especially if my balance isn't very good, or I wake up in the middle of the night to go to the bathroom. A lot of older men have enlarged prostates, and they need to get up every couple hours to pee. And a lot of time you're still sleepy. So having no obstacles in the path between your bed and the bathroom is a good thing. But I would say that families, you know, sons and daughters of elderly people, nephews, nieces, grandkids, should not shy away from having a good talk with grandma or grandpa and saying, listen, we love you, we want to take care of you, but you got to do your part and you got to let us help you.
People that come into the hospital setting that have sustained a fall, there are some very common injuries, and I think one of the most common injuries is a hip fracture, unfortunately. And other injuries that we see are extensive bruising. If someone has hit their head, they can have a bleed in their brain, which might lead to a surgery to evacuate the blood out of their brain. There's a lot of different types of injuries that can occur. So it really depends on, you know, what happened during the fall and what body part got hit during the fall.
From top to bottom, probably the worst are brain injuries. We fall and hit our head, we have a good chance of causing internal bleeding. As we get older, the older population takes medications that thin the blood to help prevent or treat heart disease and poor circulation, and these drugs can be two-edged swords because they prevent us from clotting, which is exactly what you want to happen if you have an injury. So head injuries and brain injuries resulting in coma and in basically loss of autonomy are really at the top of severity. Then any bone in your body you can break falling, and what we see a lot of are spine injuries, sometimes causing paralysis. Fractured ribs can be severe, especially in our older patients' hips, and not as often, but sometimes legs. These things can keep you in the hospital for weeks sometimes, and then when you're finally ready to leave the hospital, generally we don't go home because we're still too weak from the recovery process. So they can be life-changing events.
The message I'd like to leave with older adults is that yes, you're getting older, but you're still so capable. And there's so many things that you can do to keep improving your life and your health. And one of the most important things you can do is staying active. That's the key thing that's going to help you stay independent.
Now that we know how to make our home safer, let's talk about what we can do to make our bodies stronger and more stable. Many community centers offer workout classes that are designed to help seniors gain strength and improve their balance. And they look like fun too. We visited a class to see what it's all about.
Pick those feet up. Just march it.
I like to move. I have to do something, exercise.
Good job. Let's take it out wider. March it out.
When I started the class, back when it started more than 10 years ago, I thought, oh, this is going to be fun. And then I realized, oh, I have to do this for the rest of my life to stay in shape. So I have, and it's still fun. The balance and the cardio has been really good too. Less joint aches, knowing how to stretch out of the different joint, by doing a certain exercise. Like when this class first started this morning, this knee started hurting. I thought, oh no, how come it's hurting? But then as I kind of did it, then it worked through it.
Left, right. Good.
The main focus of this class is fall prevention. We don't use those words. We talk about balance and strength training and staying active and independent for life. So we really kind of use those keywords that are in the title to kind of encourage that activity, not only in class, but to take what they learn into their daily life, into their activities. So I do try to teach a lot of the fundamentals of core stability, posture, picking up the feet, some of the things. And every class we talk about, we have an educational talk about fall prevention. Maybe we have a share, or people might share something that happened to them, or how they avoided a fall, or different things. And then we have a lot of resources for that too.
I was so stiff, and I had lost all my flexibility on top of everything else. And this was able to give me back a lot of that flexibility, and a lot of that confidence too, because prior to coming back here, I had taken a fairly severe fall down a set of stairs. I was very cautious. It made me very cautious. And this has given me a much more confidence in my ability to move and save myself and be safe in my life.
I've had a number of people tell me that they've stopped to fall since their leg muscles have gotten stronger, that they've been able to just catch themselves, whether tripping over an animal or a child, or stroller moving forward, that sort of thing. I've had a number of them say they've gone off their blood pressure medication. Some weight loss, but not as much of that, unless they're combining a clean diet with it, then they have that. But generally it's the fall prevention benefits. Also, they're happy being here with their friends working out. It's such a good social thing for them to do and to build their confidence.
Because the people are my age, it's not like going to a gym where you have really young people that are all can do a lot more than I'm able to do at this age. And so having the comrades that are the same as me.
6, 5, 4, 3, 2. Now, knees up, cross.
And this is help a lot in getting stronger, So I have to come.
A good deal of what it did was it made me feel good about myself, because I just didn't feel as old anymore. And I definitely felt safer. And I think those two things were just phenomenal for my emotional and mental well-being as well. I mean, the physical part is always there, that saves you, but the more confidence you have and the more graceful you feel, whether you actually are or aren't, it just makes your life better, and it makes you feel much more safe and confident in your life.
There's another workout program designed to build core strength and stability. It's called Otago, but this program is done with a physical therapist. It can make a big difference in preventing falls.
First, stand up from the chair without using your hands and repeat that 10 times in a row, nice and slowly. The Otago program is designed to prevent falls in people who are 65 years and older. Research has shown that it reduces the rate of falls by about 35% after 1 year of performing the program. These are some of the balance exercises that we teach in the Otago program, and you would want to work with a physical therapist before you try these on your own. So we're going to see Robin perform heel-to-toe walking, forwards and backwards, sidestepping, heel walking, toe walking, and figure 8 walking. So I'm going to first have Robin demonstrate the sit to stand exercise. So she's going to first stand up from the chair without using your hands and repeat that 10 times in a row, nice and slowly. And the important thing is during this exercise, you want your feet to be about shoulder width apart, and your feet and knees should be facing forward. The next exercise Robin is going to demonstrate is called sidestepping. The important thing with this exercise is to make sure you're holding on lightly to a surface and the feet should be pointing straight ahead. So go ahead and step to the left. Good. And keeping the feet straight ahead. Good. And then come on back towards me. One of the benefits of the Otago program is that you can perform the exercises at home, and it will be tailored for your individual needs.
Thanks for joining us for this special program on preventing falls. We hope it's given you the confidence to improve your strength and make your home safer. If you have questions about anything you saw on today's show, please contact the Pierce County Fall Prevention Coalition or Pierce County Aging and Disability Resources, or reach out to your county's Human Services Department. Thanks for being with us, and stay safe, everyone.